without reason. It's regulated by people who are just making money out of its chaos. A few weeks ago, I was at a health conference where was I? I think I was in LA. And I was talking with a VC who's been following our company for a long time. And he said to me, he's from India, and he said to me, we're definitely going to be making more investments in the US healthcare system. I said, really? Why? It's such a mess. He said, that's where the money is.
Cool, guys. We got another episode of the WANTREPRENEUR podcast here with Renee from Together app. She's a healthcare professional, been involved in the industry for a while, and has started a company to shake things up involving AI, connecting healthcare and connecting providers. She actually started the company with her husband, which I think is an interesting scenario that we've actually had with several guests. So I'm curious to hear about that. But Renee, just for the audience of early stage entrepreneurs, you want to give just like a quick intro on you and the path to creating this company?
Yeah, certainly. And thanks for having me on the show, Chris. My name is Renee Dua. I'm a physician. I'm a kidney specialist, actually. And I'm a 2-time HealthTech founder. My first company called Heal delivered omnimodal house calls way before a pandemic. And we sold that company to Humana, the Medicare Advantage insurance plan. And about 2 years ago, I started my second company called Together. In fact, it's called Together by Renee. My husband named the entire company for me. Together turns your smartphone into a health assistant using AI on the back end. The idea is that the thousands of hours in between doctor's appointments, there are many things you or a caregiver has to do. You have to take your medicine, you have to schedule appointments, you have to pick up refills, you should check your vitals and your mental health. And Together consolidates all of those tasks into one app right on your smartphone. So you can share that information with whomever you want. You can honestly make your life a lot easier because you're not keeping spreadsheets and binders and whatnot.
Cool. So I guess like to just get into it, did you always see yourself like starting your own business or becoming an entrepreneur, or was that something that sort of came about later on into your career?
That's such a great question. I never saw myself working for anybody, even as a little girl. And the reason for that is my parents, who are both doctors and who are immigrants from India, themselves never worked for anyone. They came to this country, which is unbelievable. This was before cell phones and Wi-Fi and any kind of interconnectivity and ease of the internet. And they came here and they started their own practice. To this day, they're operating their own. They hardly see patients, but they still keep an office, which my parents have been together for 50 years. And they still go to that office and take care of their other business dealings and whatnot. And so I grew up thinking I would never work for anybody. And I'm old enough to tell you that when I finished all my training for school, you didn't just go get a job at Kaiser unless you were a loser. Nowadays, everybody works for Kaiser, right? So it was a thing to start a private practice, which is what I did as a kidney doctor. And then I met my husband, Nick, who is a serial entrepreneur and CEO. And he's the one that actually gave me the courage and the guts to try a startup. And so that's how my practice turned into tech company work.
Got it. Yeah, it's interesting because I've interviewed a few people whose parents were entrepreneurs or had like businesses, or they even if the private practice, etc. And it always is like a foundational thing to just give them the idea that's like possible. So I think it's important that people know that necessarily. But cool. Okay, so the first company you're talking about growing that, selling it to Humana. What was the general process or kind of logistics like there?
Sure, that was a wild ride. So when we started Heal, I was becoming a new mother, and it was extremely challenging for me. And I needed to get to doctor's appointments, keep working, be a good wife, take care of my partner, my parents, which I've always done. And I was overwhelmed. And at one point I turned to Nick and I said, listen, I want you to build me an app. I want it to turn on and off like an Uber. And I want you to drive me around and let's do house calls together. I'll teach you how to do vitals. I'll see the patients. And Nick did what I asked, and he built me what was then known as Heal. And it was already so sophisticated. I said to him that this has to be something that people can use all over the country and they can use their insurance. And so it's funny, when I started building Heal, it was because I thought I was too busy as a physician mother. And Heal was such a wild ride. It was so crazy, its growth and its scale. I can't even believe I thought I was busy in my medical practice. The operations behind Heal were complex because many doctors will do house calls, but they won't use software to install one-touch telemedicine and a blood pressure monitor and check in on their patients routinely. We use software to do real-time insurance eligibility. We never billed patients that use Heal, right? We gave them a flat fee or what their insurance paid. And that was all brand new software. Additionally, I had all my kids during the construction of Heal. At one point, we had to fly to see the people over at the Center for Medicare Services. I don't know how many times. So many times I got put on bed rest. There are so many stories about the process of scaling and growing Heal, mostly because healthcare is so regulated, almost unnecessarily regulated. And secondly, because the powers that be that exist in the American healthcare system, they will not renege their power, right? They will hold on and do what's right to make money before they do what's right for the patient. So it's an uphill fight. I can go on and on about scaling and ultimately selling that company.
So yeah, I was just mentioning that in our accelerator, we have a bunch of healthcare tech companies in that space. And yeah, I haven't been involved in that in none of my companies that I've done over the last however many you've been in that. So I'm just thinking like the regulations have got to be like a tough point as an entrepreneur to get past or to work around. There's already so many headaches as an entrepreneur, just financially and whatnot. Adding those regulations to it, do you really have to be somebody who's your parents being in the space, you being in the space, like already knowing somewhat about it?
It certainly helped me. And to give myself a little credit, that was my first startup that I sold to a major health plan. I think many entrepreneurs do this time and time again, and they don't necessarily have an exit. So the fact that I think, what do we call it? A Nepo baby, right? I think it's helped me tremendously. When I finished all my training to become a doctor, I was able to start my own practice because I had someone who had done it before telling me, here's what you do. That's not to say I didn't make 100 different mistakes, but it is to tell you, starting a medical practice on wheels still requires how to patient bill, how to credential as a physician for health plans, how to read an insurance contract, right? I had to teach myself routing and dispatch, and now I do a lot of product and I sit in places like Jira. I didn't know what a Jira was 10 years ago, right? Or 12 years ago. So I think there's no question having a medical background helped me tremendously. Having parents who already did so many things helped me. And I, by the way, helped them in the practice that I was building. But being in health tech is different because the resilience you have to have it's really next level. There's lots of industries that are regulated, but healthcare is almost regulated without reason. It's regulated by people who are just making money out of its chaos. A few weeks ago, I was at a health conference where was I? I think I was in LA. And I was talking with a VC who's been following our company for a long time. And he said to me, he's from India, and he said to me, we're definitely going to be making more investments in the US healthcare system. I said, really? Why? It's such a mess. He said, that's where the money is. The fact that it's a disaster is how people take advantage and make money off of it. So anyway, I think, again, I had some understanding of that. I knew what I was up against. It was even bigger in a 300-person company spanning 13 states and hundreds of thousands of house calls. But I was prepared for that. Whereas my team who got Heal off the ground, they had to be educated by me, and I had to explain and give them stupid answers. That's just the way it is. We got to deal with it. We got to find a way around. I think in most startups, you want someone who doesn't just say no, who can't find a solution. I am a person who I rarely just say no. I try to figure it out. And that is a super important quality in healthcare and health tech, for sure, in the United States.
Nice. So I guess for people who are like unfamiliar with what it takes, like just building a company like this, where does like most of with Together, like where does most of your time go? Is it product development, dealing with customers, partnerships, investors? What's the time split look like?
All of the above, certainly for Together. So after running Heal for 9 years, I realized that the solution I next wanted to build would be more software heavy versus people intensive. I had, 300 reports at Heal at one point. That's a lot of people reporting to you in various ways. And I realized, as much as I enjoyed my team, I wanted to build software to replace a lot of the human functions you don't need humans to do. To give you an example, and the reason my husband named the company Renee is because I'm the health assistant for my parents. And so I call and make sure they have refills and they get delivered and they know when their appointments are. And at one point before we started the company that I'm at now, I said to Nick, why am I doing all this? This doesn't need a human to do this tech. And then AI has really taken off. And so we're using intelligence to complete a lot of these tasks. I think when you're looking at how a founder spends time, it's on everything. A founder does every single thing. How I enjoy spending my time is on product and with the engineering team. How I spend a lot of my time is with investors, of course. They want to know how their money is being spent. And then I happen to personally reach out to a lot of our customers. I did at Heal too. I would go personally on house calls. Because you don't know how what you've built is working unless you do it yourself. And I'm very much a boots on the ground kind of person.
Got it. In terms of like, how do you build out the technology just as far as like a tech team? Do you know what I'm saying? Like,
yeah.
Do you have a knowledge of that type of stuff, app development and whatnot? Or
I do to some extent. And the most important step to building software is finding a person to whom you can have a very deep relationship with from a product perspective. So the person that I worked with at Heal and the person that I worked with at Together to develop both products is the same. And I have known him for 15 or some more years. And that is really important because when you're building a product, especially in a complex environment, you want someone who understands your goals. Maybe you don't even have to say them. And so anything I build always has the overarching promise of improved health experience. It's going to be easy to use. It's going to be easy for older people to use. And even though it's technology, it's not going to feel like technology. So our head of product at both companies is a guy named Amir. Again, we've been friends for a long time. He is the person who translates what I want, and he tells the engineers, this is what Renee wants to see happen. I do work as well a lot with the engineers, and we do Zooms and calls, and I look at what they're building and I give them my direct feedback as well. But when you're building a team, in the beginning, maybe you don't need a product person, depending on how complex what you're building is. Maybe your engineer can take on some of that responsibility, your lead engineer. But if what you're building, you want to affect the masses and you want it to scale quickly, you're going to want to have someone who can do that translating for you and then tell you, here are the types of engineers we should hire. Even if that product person is technical or not, they can give you some back end and front end experience of the engineers you're going to be working with.
Got it. Yeah, I think it's interesting that you had the same team or the same team member from company to company. I'd noticed the same thing where it's like when you develop, you're not technical, but you develop that sort of head-to-head with your technical person.
Precisely.
It's critical to have that line of communication open.
Absolutely.
What about other departments like marketing? Is there a sales department or what other team members would you bring on that are critical?
Yeah, I think in the very beginning of a startup, you're doing your own sales, right? You're doing direct outreach, you're doing direct social media marketing, and you're doing your own growth. But depending on how you're selling, so Together is a direct-to-consumer product. So it's a lot of building awareness on social media. I do a lot of press. That's one of the other ways I spend a lot of time. I sit on podcasts and whatnot with people like you, and I share.
Like us.
Yeah, it's a hugely helpful medium because just today, again, I was in the inbox for our customers, and an influencer emailed us and said, "Hey, I checked out your app. I loved it. And I promoted it on my Instagram of 50,000 followers," right? That kind of thing is really the way we've grown to nearly 50,000 users in the last 6 months, right? The press. But I think also when you're D2C, you have to grow that way. Heal was a business to business sales. That is heartbreaking, exhausting work to sell into health plans. We had 50 plus health plans that were using Heal across all these states. That is very challenging to do. Those sales cycles can be a year long, and the method by which you are selling is ridiculous. You have 10 people from the health plan sitting on the phone. None of them is particularly risky because if it doesn't work out, they're going to lose their job. So everybody's just blank. No, not interested. No, not interested. You have to get through, you have to hope to get to the next meeting. You have to stay alive. And let's suppose you stay alive, then they give you a list of 100,000 patients who need your service, half of which don't have correct phone numbers, addresses. It's ludicrous. Health insurance, they have so much data, all of which, again, by design is mismanaged, misplaced, not handled correctly. And when I started Heal, I was on those calls. I sat and listened to those no's time and time again. Now, in part, it's why I didn't want to sell to health plans again. I just found it a waste of time. Now I'm more focused on a direct-to-consumer approach because I think it helps patients more in a less perverse way, where I'm really giving them feedback immediately and they can do with it and share with whomever they want. I like that approach a bit better.
Got it. I guess, so have you thought about, you were mentioning like the content, the podcasts, traditional press avenues, like has any social media channel been of like interest as far as like just promoting to the consumers or to the end users?
I think the best one for promotion is Instagram. Interestingly, that being said, and LinkedIn, because a lot of what we're doing is very interesting to corporate people, pharma companies and whatnot. I feel like Instagram has the most virality. I don't feel like anybody is using Facebook anymore. I feel like TikTok is too young for us. And I, of course, actually really like YouTube. Certainly for mediums like this, I love sharing on our YouTube channel. But social media is a tough nut to crack. First of all, we're focused on an older population. We're focused on their caregivers, some of whom are young and, of course, do share what we're doing. But I think in general, a lot of people buy their users, right? I don't think they're real users or really engaged. And so and certainly there's so much noise in the social media space. So that makes social media a very difficult thing. That said, like I told you, this customer service email today, right? It does happen, and I think it is helpful.
Got it. Yeah, I think that's interesting because when I was just reading about the company, I was thinking about the age of the people who are like most fit. Obviously, it could be anybody, right? Because they need medications, but you got to think about those needs increase as they become older.
Yes.
So that's an interesting one. Have you thought about like any other? I saw like some mental health features. There's other expansion places where you can go. How are you thinking about that?
Yeah, so we already have mental health on the Together app, and so you can speak into Together. It will listen to the sound of your voice and determine if you have symptoms of anxiety and depression. And this is really critical because you might have high blood pressure because you have anxiety, or you may be a diabetic and you're not compliant with your medications because you have depression and you just can't focus. A couple of the interesting features that we have coming. First, Together we'll be able to call and make your refills for you. So we know when your medicine is due for a refill, instead of you sitting on the phone, remembering your RX number and all this nonsense, we'll do it for you and we'll make sure we'll notify you when everything's ready for pickup or delivery. That's one. Two, you can take pictures very soon of your insurance card, and Together will tell you your in-network benefits. So this is really important because right now, if you know your health insurance and you want to figure out a doctor that you want to see, or is UCLA an in-network hospital, you have to call a number or try to search on the internet. And again, by design, very confusing. And Together will actually parse through tons of data, health plan information and tell you. And then finally, and most interestingly, is what's going to be called the Together Companion, where once again, you can talk into Together and share your symptoms. And because Together knows a little bit about you, it will say, if you're having nausea, take Zofran. I'll check back in 30 minutes. And you can say, I'm still having nausea. And Together will say, I see you have Compazine. Take it and I'll check back in 30 minutes. And you can say, I'm still nauseated. And Together will say, I see that Dr. John Smith is the physician that prescribed these medications. Would you like an appointment? Would you like me to find you an urgent care network? So Together starts acting as a guide using information it already knows about you to help you figure out what to do next, right? Symptom management, if you will.
Yeah. In terms of the AI component, have you found that to be like helpful or a challenge with branding? Like I have one of my companies that I'm invested in is a AI dialer, B2B use case, and nothing to do with consumers. But like, do you find that that's something that people are attracted to from a marketing?
Yes, from a marketing to, for example, pharma companies, yes, because the overhead of humans, doing these jobs is not interesting to them. It's too expensive. It's cost prohibitive. From a patient perspective, I think our patients know it's coming. And they are very well informed. Our website says it right at the top, right? Experience what AI can do. And so they're aware. I think the distinction from what we've done is we've used closed data sets, and me and other physicians, we have trained our language models. So it's not a hallucinating issue. It's not an incorrect information issue. None of those things are really happening. We are saying exactly what medicines the user takes, and we are training the user to say, if you see these medicines, it's indicative of these conditions, and here's how we can pitch in and help. At no point are we replacing your doctor? We don't want to be your doctor's office. And we, of course, say all of that in our terms of service. But we really are acting as a guide. It may not be perfect, but at least we can say, this is how far we can get you. Let us call your doctor and get you some more help.
Got it. So shifting gears a little bit, obviously you mentioned at the beginning, like working with your husband on the company. How is that? I just talked to a guy earlier today who was talking about co-founding his family or his relationship.
Yes.
Like, how does that work? Have you found that to be something that's like really works for you guys or for the company? But just give me the details on that.
On a professional note, I have no confusion about who my boss is. I think co-founders who are partners can be confusing if everybody wants to be in charge. I don't have that problem. I'm happy to be second up to the CEO, and I'm happy to let Nick make the decisions. Nick has a particular skill set that very few CEOs actually have. Number one, he can pitch anybody about anything, anytime, and it will be an excellent, world-class pitch that will raise money, right? He's raised hundreds of millions of dollars, and that's his second superpower, is fundraising. He has raised hundreds of millions of dollars. I know where my skill sets are. I'm not going to say I don't know how to pitch or I don't know how to raise money. I'm not as good as him. And that's a really important set of skills for a CEO. I think the challenge in being co-founders is when you have children and you both have to travel or you both have to be on a call. It's very difficult than when it's a family business. That said, I would not change our operation for the world, because I mentioned to you, for example, I had 3 kids in my last company. That was hard, right? And I didn't take maternity leave. I went back to work, and I had a super invested partner to say, let me hold the baby while you do these things. I can't exactly do that to a CEO that I don't live with or who doesn't understand my situation. So I think I wouldn't change it. I love it. It is not for couples who cannot figure out who the boss is. I will tell you, Nick is not the CEO of our house, right? I'm not interested in his input on managing our home or whatnot, getting our kids to bed on time, etc. So we have it figured out. If you haven't had it figured out, if you're not lockstep in how you want to run your marriage and how you want to run your business, I don't think it will be easy. I'll tell you one funny story. When I first started with Heal, my very first VC meeting was in Los Angeles with a VC who said, I don't invest in husband-wives. And he looks at Nick and says, what are you going to do when you get sick of her? And that was my very first VC meeting. And I thought, wow, what a dope. What did I just leave an incredibly busy kidney practice for? This is the job. Obviously, that sentiment has improved, though not completely. I still walk into
I've heard that
people go up to Nick and say, hi, Dr. Dua. Don't know how to use the internet. But I will say the business of being a partnership at home and at work has grown, and it's happening more and more because there's a sense of trust and dependency that you can count on. I think that's important.
Got it. I'm just opening up. We're streaming this too, so I'm getting questions coming in from the group here.
Sure.
Danish says he runs a copywriting agency, and he's just commenting, I guess, on the using, like, do you use Facebook ads or do you do any paid media to hit that older demographic?
Yeah, we did. Facebook is a nightmare from a support perspective. They're so difficult, and they're very difficult about healthcare ads. And we didn't see any amazing lift from it, so we paused for a while. It's something we'll think about doing in the future.
Got it. Interesting. Is there any other channel that has just worked really well for acquisition? Have you done a lot of app store optimization?
Yes, we have.
You know what I'm saying?
That has helped a lot. And even Heal, we were, what do you call it? It's escaping me, but we were featured multiple times on the App Store at Heal, and we will be for Together as well. And that is a really important thing to do. I would say of all the social media channels, the one that has brought the most growth is LinkedIn. Again, from a business perspective, I would say from a user perspective, I don't think any of them have been great. And I think it's because of the age of our user base.
Got it. Just tying everything together, what from both companies, just your entire sort of path here as an entrepreneur, like what are some big takeaways or lessons that you've learned that you didn't know before you undertook
My gosh,
the last however many years?
We have such a limited amount of time for me to answer that question.
Yeah.
I would say startups are for people who can put a lot of their lives on hold, right? Everybody says work-life balance. I have no idea what they're talking about.
Doesn't exist.
I don't even know. I've never known what that means. I don't think most doctors do. But I certainly had zero work-life balance at Heal. Zero. I worked so hard at that company. I loved every minute, but I worked very hard. And at this company, I work very hard. So I would say there's a part of your life that's going to be put on hold. It will affect your family, your children, vacations, hell, sick days. It's hard, right? That would be one. That's not a reason not to do it. But again, if you're looking to be able to clock in and clock out, I think there's nothing wrong with that. You can't do that with a startup, right? That would be number one. And I would say number two is if you want to do a startup, being in a very heavily regulated industry is soul crunching. I don't know. It is so hard. Healthcare is disgusting, right? To some extent. And that, again, you can fix little things, but you have to be willing to fix them within the mess, within the paradigm that already exists. Otherwise, you won't get venture capital, you won't sell your product, you won't have users, and you're wasting your time. So I think certainly in healthcare, I would think long and hard about a startup in this environment for sure.
Just a question from the group here. What's your long-term goal of the company and how are you trying to get there?
So together I would love to just grow. Right now, I would love to grow. And we're working on monetizing a lot of the data, the de-identified data. And to give you an example of what I mean, we have thousands and thousands of users who use medications that are difficult to find or require adherence. I'll give you an example of Ozempic, right? We have users who are on Ozempic, they can't find it, they don't take it, they're having side effects, they're having mental health issues, and the pharmaceutical companies need to know this information. Again, it's all de-identified, but trend lines and that kind of data is very valuable to pharmaceutical companies. So we're looking at monetization in that way. So I would say the next steps for Together are to grow more. We need many more users, and second, to focus on the monetization.
Got it. Cool. Renee, where can people find you? How do they get in touch with you? How do they follow what you're doing?
Sure. So first of all, you can always find me on LinkedIn. My name is Renee Dua, and that's DUA. And you can always email me. My email is very simple, Renee, RENE @renee.com.
Cool. Renee, thank you for coming on.
My pleasure. Thanks for having me.
Awesome. See you guys. It's the WANTREPRENEUR podcast.
Are you ready?